Our next speaker is Gary Johns. He's the Associate Executive Director at the Australian Institute for Progress. He's an adjunct professor at QUT Business School and a columnist for The Australian. He served on the House of Representatives and in the Keating governments. He was an Associate Commissioner of the Commonwealth Productivity Commission. So, welcome, Gary Johns.
Thank you. I think we'll be in furious agreement by and large, so I'll try to pick out some different illustrations of pretty much the same discussion. Now, it just so happens that we've recently published a book of mine called Your Body Belongs to the Nation and Other Public Policy Lobby Errors. So I think the presumption of many in the public health lobby is that somehow you need to do good for others, which I think is quite wrong. The phrase "your body belongs to the nation" is in fact one coined by fascists in Germany in the middle of last century, because their view was that you had a responsibility to the nation. So on that fascist foundation, a great deal of public policy, public health discussion rests. And I think it's a disgraceful foundation. Your body belongs to yourself and no one else, except, of course, if what you do as a consequence of your decisions affects someone else. Now, I'm not a minimal regulation sort of fella. I'm not necessarily comfortable among libertarians because some regulation is good as long as there's a payoff. So I've concentrated in the book on the 6 arguments that the public health lobby make about how they are doing good. And in each case, we prove that they're more likely to do more harm than good with their recommendations. And I have a cute little phrase, says that there is no inoculation for your bad decisions. So if you make a decision, a doctor is unlikely to fix it with his or her prescription. Now, I take as a starting point the long-running battle against smoking tobacco, because that's become the template, if you like, for all other programs against fat, sugar, alcohol, gambling, etc., etc. And there's a brilliant cartoon, or illustration rather, put out by the Sri Lankan Diabetes Association, which has a photo or illustration of a cigarette made up of brown sugar and white sugar crystals. So the image is overpowering. They're really saying sugar is as harmful to you as burning tobacco, smoking. And they even have some words that suggest the same number of people will die by the ingestion of sugar as tobacco. Now, I think that's probably quite wrong. But even tobacco and the campaign against tobacco is now way oversold. So let's start with this. So I was listening to the Federal Treasurer deliver his budget last May, and he announced that there would be four increases in tobacco excise at 12.5% per year for 4 years. And there was a great cheer went up from his side. He wasn't announcing that the tobacco excise rises would solve your health problem as a smoker. He was announcing that there would be revenue of $4.7 billion from the tax. So, and I thought, well, hang on, I've heard that before, 4 years in a row of 12.5%. And I checked the tax office website, and sure enough, the Treasurer in 2013 had announced 4 12.5% excise rises, cumulative, over 4 years. So that means we're going to have 8 years in a row. Now, I shop down the local Coles and I see the people who are buying cigarettes. They don't have a lot of money. and no one's pretending that they're likely to give up cigarettes. So this is what I'd call gouging, to no health benefit whatsoever. And if you look at a graph of the prevalence of cigarette smoking in Australia, it has trended down. It's halved over 25 years or so. But the key elements, it seems to me, if you map out the policy events over that time, were these. Way back in the 60s and 70s, it became clear, scientific proof was made available that smoking can kill you. Now, eventually, people got the message. So good information was, I think, the most powerful thing here. Then, of course, there are very strong sort of programs against advertising cigarettes and tobacco. So you remove the immediacy of going to the shelf and buying tobacco and so on. There were only 1 or 2 tax rises early in the period of the decline. So I think, if I could sum it up, we had in the tobacco game a change of culture based on better information. And that seems to me to put people in a stronger position to choose for themselves. Governments came along at the end and then really ramped up the taxation because they could, because they had a cover. And the cover was they were said to be doing good. Now, gouging is just one of these 6 different elements that I raise in the book. And I'll just go to this question of Jelena raised about substitution of other products. There's some lovely studies. And there are sufficient good economic studies around to disprove most of the public policy health lobby material. And one was a beautiful one, a little one, where there's an experiment in a US small city where a number of people were to be taxed for the sugar content of what they purchased, sugary drinks, sorry, and the other half were not. And they compared their purchases over 6 months or so. Now, in the first month, there was a decline in the purchase of sugary drinks for those who were taxed. After 3 months, not much decline. 6 months, almost no decline. But the thing that the researchers noted was that the households who bought sugary drinks and beer and that were taxed on sugary drinks drank more beer. That was their substitution. The study is called From Coke to Coors. Coors is the beer, the US. So there it was, a substitution effect. There are even instances where those who bought lots of sugary drinks after the taxation was imposed drank even more sugary drinks, the cheaper ones. Another lovely little illustration was people in a school district in Oregon were worried about obesity among children and thought we would take chocolate milk off the school shelf from the tuck shop. And this was studied very closely. Knowing that milk is good for children, they took chocolate milk off the shelf. The result? Children drank less milk. The price of milk went up because the purchase of bulk wasn't available to the school or so readily, and the amount of waste milk rose because kids would have a little bit of the white milk and no more. The people researching this didn't look at this as part of their research, but their suspicion was that kids also substituted by snacking at other times, at school and home. So the substitution did not work and in fact may have done considerable harm. So there are dozens of these sorts of well-respected economic studies that suggest that by imposing taxation and heavy rules on people to try to tell them how to live, beyond the simple one of just giving them some information, does not work, but governments are in favour of it because, by and large, they derive benefits of taxation. And just one more little one, we have a minute. There was a very good study undertaken of the effect of a rise or a lift in alcohol excise. And the economists made this point, and I'm trying to remember the figures. The net benefit, that is, the benefits would derive from all of us by a lift in excise on alcohol in this study, were fairly minimal. If applied in Australia, it was about less than $1 billion a year. But the tax revenue was about $6 billion a year. So you can see how it would appeal to a treasurer. And the level of excise that would be required to achieve this so-called net benefit and that amount of revenue was a lift of 145%. Now, those who are hired by organisations, in this case the Federation of Alcohol and Research Education, which is a government-funded NGO, of course wanted to be paid for their money, so they stated this position of 145% rise in excise very, very carefully, and noted that something like this was a rise that would not be seen anywhere in the real world. So this stuff, which we hear publicised week in, week out by the public health lobby, which is usually paid for by you, doesn't do any good, may well do considerable harm. Thank you.